Hey guys, this is Dr. Hub. Today we'll look at the thalassemia syndromes. So, firstly, normally each individual they carry 4 functional alpha chain genes. So, normal individual they carry 4 functional alpha chains, and there is also this is the alpha chain gene. Next is they contain 2 functional. This is a beta chain, 2 functional beta chain genes. So the alpha and the beta thalassemia are inherited disorders. So the alpha and the beta, they are nothing but it is inherited. This inherited disorders, and they in which there is a reduced production of alpha globulin and the beta globulin chain. So there is reduced production of the alpha and the beta. This is a globulin, alpha and the beta globulin chains. So let's look at what is the alpha thalassemia. So if you look at the alpha thalassemia, so here the gene deletion is the most common cause of the reduced alpha chain synthesis. So the gene deletion. So in alpha it is a gene deletion which plays the most common cause of the reduced. So it plays a most common cause of the reduced alpha chain synthesis. Next, we move on to the beta. So what about the beta thalassemia? So beta thalassemia, this is the most common cause in is splicing mutation. The most common cause is the splicing mutation. Next is the beta, and this is going to be the beta thalassemia. And here there is a chain terminator mutations are the most common cause. There is a chain terminator mutation, and this is nothing but the most common cause. So now let's look it in an easier manner. So now we are going to discuss what are the alpha thalassemias, the types, and we are going to see the details. So as per the alpha thalassemia, we are going to look at the HB warts. The HB warts, the genotype, it is negative, and looking at the lab findings, there is a severe microcytic anemia. There is presence of severe microcytic anemia, and this is with the hydrops pitalis. This is with the presence of the hydrops pitalis, as well as the fetal in utero. It is fetal in utero. Next comes the hemoglobin electrophoresis. The hemoglobin electrophoresis. So hemoglobin electrophoresis is nothing but the HB warts. The HB warts, and there is a gamma globin tetramers. There is a gamma globulin tetramers, as well as there is a HB. There is a HB portland. This is the embryonic hemoglobin, or there is no HbF, HbA, or the HbA2. So this was all about the HB warts. Next we are looking at the HbH disease. So the HbH disease, this has a genotype of alpha minus, or the alpha minus. So this lab findings is that there is a moderate microcytic anemia. Moderate microcytic anemia. Then let's look at the hemoglobin electrophoresis. So as per the hemoglobin electrophoresis, there is a HbH. HbH, that is a beta globin. HbH, that is beta globin tetramers, and this is up to 30%. This is up to 30%. And then there is also the HbA2. This HbA2, and this is up to 4%. Next, let's look at minor. Looking at the minor variety, this has a genotype of alpha minus or the alpha alpha minus minus. And what is the lab findings? Lab finding is that there is a mild microcytic anemia. There is mild microcytic anemia. Next, we look at the hemoglobin electrophoresis. So, as per the hemoglobin electrophoresis, there is the HB bars, and this is about 3 to 8%. Next, we move on to the silent carrier. The silent carrier, it has alpha alpha and alpha minus. So, what is the lab findings? The lab finding is that there is a normal hemoglobin as well as a normal MCV. Next, we look at the hemoglobin electrophoresis. The hemoglobin electrophoresis. So, this is normal. This is normal in terms of the silent carriers. Now, we look at the beta thalassemias. So previously what we saw was this dash, it means the deletion. It means the deletion of the alpha gene. And A means it is a, alpha means it is a normal gene. And A star means that it is a mutant gene. Now to continue, we will look at the beta thalassemia. So, in terms of the beta thalassemia, there is the major transfusion, the major component. So, as per the major component, it includes the genotype of B0. So, what does B0 mean? Let's check the short forms. The B0 means it is no beta globulin. So there is no beta globulin production. And what is B plus? There's B plus. B plus means there refers to a decreased beta globulin production. There is decreased beta globulin production. Now let's discuss in terms of major. That is a transfusion dependent. So here the genotype, it includes the B0 or the B0 or the B plus. So B plus refers to the decreased beta globulin production. Then we move on to the lab findings. So in terms of the lab findings, it can be a severe microcytic anemia, and this is with target cells. This is with the target cells. So there's a typical HB3. It is a typical HB3 to the 4 gram per TL. Next, we look at the hemoglobin electrophoresis. So as per this, there is HbA2. This is about 5% or more, and there is also the HbF. There's HbF, and this is up to 95%, and there is no HbA. Then we move on to the intermediate. So let's look at the intermediate. The intermediate, it includes, there's a non-transfusion dependent. There is non-transfusion dependent. So this will include the B plus. B plus means it is a decreased beta globin production. So in intermediate, it is B plus and B plus. Then we look at the lab findings. So what is the lab findings? It includes, there is moderate microcytic anemia. There is moderate microcytic anemia. Then comes the hemoglobin electrophoresis. So as per the hemoglobin electrophoresis, there is HbA2 and 4% or more, and also the HbF, and this is greater than up to 50%. Lastly, we'll be looking at the minor. So as per the minor, this is also called the trait or carrier. Trait or the carrier. So the genotype it involves is a B or the B naught or B slash the B plus. So the minor, it is the lab finding will be, it is a mild microcytic anemia. There is mild microcytic anemia. Then comes the hemoglobin electrophoresis. The hemoglobin electrophoresis is going to be the HbA2, and this is going to be 4% or more. So 4% or more. Then comes the HbF. The HbF will be up to 5%.